15 जून 2024 को अपोलो हॉस्पिटल्स द्वारा एक प्रेस कॉन्फ्रेंस आयोजित किया गया, जहां डॉक्टर के रघुनाथ द्वारा कैंसर और उसके डायग्नोसिस के बारे में बात की गई।
We do cancer surgeries, laparoscopy. वो इतना बड़ा ऑपरेशन इधर कर सकता है और क्या हमको नहीं जानता, बट कैंसर का ऑपरेशन भी पूरा लाप्रोस्कोप में कर सकता है, रोबोटिक में कर सकता है। कैंसर ऑपरेशन इधर कर सकता है और क्या करने के बाद कौन देखता है, वो भी सोचना चाहिए ना। गॉल ब्लैडर, हर्निया, ये पूरा लाप्रोस्कोप में हो जाता। कोई आदमी को लोकल एनेस्थीसिया में कर सकता हर्निया भी, देन वो इधर आधा घंटा ही रहना चाहिए ऑपरेशन के बाद, उसके बाद चले जा सकता घर हर्निया के बाद। So all that we can do, whether it can be done here, I don't know. I'll see and then we'll decide. हाँ, कुछ है तो प्रॉपर असेसमेंट इधर कर सकता। ऑपरेशन चेन्नई में लाप्रोस्कोप में होने के बाद एक हफ्ते के अंदर फिर वापस घर आ सकता है। If it is cancer, if it is cancer, I think so. We will not be able to operate here because ऑपरेशन करने के बाद देखना चाहिए ना। देन उसका थोड़ा सा इधर लोकल डॉक्टर्स के साथ कुछ जॉइंट काम कर रहा तो ऐसा कर सकता है। मे बी कैंसर ऑपरेशन भी इधर कर सकता है। उसके बाद कोई सर्जन्स, जूनियर सर्जन्स कुछ है तो इधर वो भी हम एक्सप्लोर नहीं करा, बट इवेंचुअली वो कर सकता है। कैंसर को ऑपरेशंस विल बी डिफरेंट। सो कौन सा ऑर्गन से कैंसर है, all that will be different. So exactly बोल नहीं सकता, it will vary from patient to patient. वो तुम इधर फाइनेंस डिपार्टमेंट में पूछ लो, बट टेक्निकली कर सकता है और क्या वही हम देखता है। कितना खर्चा होता मे बी you should ask people who are dealing with the finance. I think so. See, this is my first time in Andaman. I seem to like it. हम फिर देखना चाहिए, बट इधर कर सकता हमको लगता है, क्यों नहीं कर सकता। इधर आईसीयू है बोला, so if everything is there then we can do, but I have not checked yet. चेक करने के बाद then आज शाम हम कोई लोकल सर्जन्स एंड डॉक्टर्स मीट करता है, वो एक्सप्लोर करना चाहिए हमको लगता है। इधर ही हम वास्कुलर सर्जरी भी कर सकते हैं, किडनी ट्रांसप्लांट भी कर सकता है, ऐसा लगता है हमको। आई डोंट नो, किडनी ट्रांसप्लांट को इधर से पेशेंट्स चेन्नई जाता और दिल्ली जाता, वो नहीं जानता, बट आई थिंक वी कैन डू इट। वी नीड अ गुड पोस्ट ऑपरेटिव केयर, राइट? मोस्ट ऑफ द टेक्निकल थिंग्स विल बी एबल टू डू। सर्जरी हो जाता, सर्जरी विल बी मे बी 4 hours 6 hours, that will be done, but ऑपरेशन के बाद देखता को we need a good setup, which I think we'll be able to arrange and do. Breast cancer, all that is not very difficult. Breast cancer operations, morning operation, evening discharge. So for that we don't need anybody. But intestinal cancers, they'll have to be admitted. I also feel that these patients who will need complex surgery, cancer of the liver, pancreas, all that can be fully tested here before they come there. All that can be done here itself. All that can be done online and all that. Then उसके बाद कुछ करना है तो तब travel कर सकता है ना. Otherwise, most patients are traveling and then we are not able to operate even there. Then it is more difficult for them to come there. उसके बाद फिर वापस आना चाहिए. So that also we can avoid. Mainly, I want to say that elderly patients, if they have a hernia or something, वो 1.5 घंटे के अंदर hernia operation होके घर भी चले भी जा सकता है. That can be done. That can be done here. भर्ती को कोई ज़रूरत नहीं. For almost all hernias can be done like that. Very big hernias नहीं कर सकता, but most of the about 80 to 90% of the hernias सुन करके कर सकता है, right? Like dentist इधर ऐसा करा, then operation के बाद OT से चले जा सकता है, right? So that can be done here. I don't know if people are doing hernias like that here, but that can be done. I'm not entirely sure if that is the case. See, maybe so, but earlier patients had many other infectious diseases and all that used to take our concentration, like TB, malaria, typhoid, cholera. People were, you know, having all that. And also, these investigations were also not there. That many CT scans and ultrasound, MRI, all that was not there 30 years ago. So people just continued to have the disease presented quite late. Now, when they have a little complaint, we are able to investigate better. So we are picking up these tumors. So if we pick up early, then we are able to treat them also. So cancer does not necessarily mean that there is no hope. If it is caught at the right time and the correct treatment is given, then there is a significant proportion of the patients who can get better. They can live normally also. There are thyroid cancers, for instance, are treated very well and they are all normal. Thyroid, most of the breast tumors, all that can be done. Basically, one needs to have a reasonably good medical acumen not to miss serious problems. But generally, if you don't have to miss a serious problem, it will need investigating. Without the suspicion, you are not going to investigate, and that is when it looks as though people are getting too many investigations. But then, if you have 10 patients who are anemic, out of that, 2 patients may have a tumor. So you can do a basic blood test, and if the suspicion increases, basic blood test, basic motion test, all this can be done by transporting the sample. If you have a good collecting system to send the sample, then that itself will solve most of the problems. And then when you have a smaller group in whom you are suspecting that the disease is more likely to be there, those patients alone need to be scanned and investigated. There is no other way around it. I really don't know what is there in Nicobar, but I'm sure in Port Blair you'll be able to get all these. I really don't know. See, everything probably is directly linked to the economic status of that particular country, I suppose. Right? Maybe all these, if they have more financial clout, all this can be, sorted. But if it is not there, I see it as a problem. But then, this is the only way around it where you can send the basic samples at least out. If you don't have a facility, I'm sure to do the testing, I'm sure, at least the sample can be collected and sent for testing. Improve the diagnostic accuracy or subselect a group where more testing will be needed. That has to be, dealt with at that level, I suppose.